have you here today.
Hi, Cindy. I'm so happy to be here.
You're going to educate us in the Essence of You group on Botox and fillers, a very important topic for those of us that are starting to go south everywhere.
Happy to do that for you.
So, why don't you tell us a little bit? Well, let's start with just tell us a little bit about your practice.
Well, my practice is an aesthetic practice. It's non-surgical and minimally invasive. All the procedures that I do not require a trip to the hospital and do not require a knife.
That's awesome. So, how long have you been doing it?
Well, I've been doing it here for 2.5 years. I've been in medicine for over 25 years as a surgeon, a microsurgeon, a hand surgeon, and an orthopedic surgeon.
So, what made you decide to make women look more beautiful?
Well, aesthetic medicine is an emerging field, and as I started to look at it, I saw things that were being done that I approached differently based on my background. As an orthopedic surgeon, I work from the skin to the bone and all the tissues in between. And I was looking at the face and at the hands and the things that they lose as one ages and how you can restore them.
Awesome. Well, great. Well, I am not embarrassed to admit that I have had some work done by you, and it's been a fabulous experience. I love a couple of things. I love that I never bruise. I love the way you are so gentle with me and you kind of help avoid pain. I love the follow up and the care that you give, and that you really only give as much of a treatment as I want instead of trying to get me to do the next thing.
Thank you.
Yeah.
The fact that I'm a microsurgeon makes me by definition very gentle. We don't like bruising. We don't like as little trauma as possible. And certainly along with that, I want to cause my patients as little discomfort as possible. So I always tailor anesthesia to what they're having done and what their needs are.
So one of the things I've noticed is that now I feel like everybody and their brother is doing some kind of Botox. There's Botox parties. Dermatologists are doing Botox. Gynecologists are doing Botox. So I feel like you guys are unique. You're a boutique office and practice, and you don't have a gazillion patients coming in and out. But for people who are curious on how do I know who to go to, what would you say about that?
Well, aesthetic medicine is an emerging field, and Botox in and of itself is the number one non-surgical cosmetic procedure performed in the world. It's a fantastic pharmaceutical that's been used a long time in different areas of medicine, and a lot of people are using it for different purposes. You don't have to be a physician to inject Botox. There are nurses who can inject Botox. There are physician's assistants who can inject Botox. And it's fairly common to see people that don't have the level of experience doing this that they should.
Okay. So is that why you're better at the no bruising thing? Because you're better at knowing where to inject and you've got that experience? Is there any risk to going to others, or what would you say about that?
Well, I think there's always risk. I'm fairly careful as far as injecting it and avoiding vessels. One of the things I personally do is I use cross-polarized light so I can see blood vessels under the skin so I can avoid them and you don't get bruising. I find most patients are told that they're bruisers when in reality it's the physician who's doing the bruising, not the patient.
Got it. All right, so let's move on to what is Botox and how would we know whether we should get Botox or fillers?
Well, they're two very distinct items that are quite different. Botox is a purified protein pharmaceutical that's been used in medicine since 1977 to control muscle function and has been used cosmetically to relax lines since 1989 by injecting in tiny, tiny amounts into the muscle and thereby weakening it. A dermal filler, on the other hand, is a surgical implant. It restores volume that you've lost from your face or from under your eyes or along your nasolabial folds, your smile lines, and it gives volume. It's a different function. Now, interestingly, both Botox and the various dermal fillers that are available work very nicely together to produce a beautiful result if done correctly.
Okay, so it sounds like most of us could use both if we choose to do that. So help me understand. So I think that it's like in the creases, in the if we have an 11 or if we have frown marks, that's where the Botox goes. Now it used to be, was it Botox we put in here and now you're lifting? So
Uh,
explain like the anatomy of the face and where we put what.
Botox is used to weaken the muscles that produce wrinkles in your face.
Okay.
As we age and as we lose hyaluronic acid from our skin that dries out and a lot of muscle usage, we get lines forming in the corners of our eye, the 11s between your eyes, on your forehead. And Botox relaxes that muscle and helps smooth them out. The other thing that happens in the aging face is that we lose fat, we lose hyaluronic acid, and we lose bone. So as we age and we lose that, things start to sink and go south.
Right.
So in rejuvenating a face, we try to lift everything up and get it lifted up. We fill the areas where there's been loss. Women typically lose their fat in their mid-face, and as they lose their cheeks, they start getting those folds that you were pointing at, which are the nasolabial folds, or the marionette lines. So as you restore those, and with various fillers, you can reproduce that, and you can raise things up. Okay. And that's basically what we do in different areas. You can do that with the lips, you can do that with the cheeks, you can do that in the lower face as well as in the hands, where we also lose soft tissue, and you start to see vessels and tendons more. You can rejuvenate hands as well by putting in dermal fillers.
What about women that have this fold here? Can we lift that up?
Yes, one can lift it up. What you're talking about is a brow that starts to sag. And in the face, the mimetic muscles, which are the muscles of facial expression, they can raise everything up or they can bring everything down. So if you control those various muscles, you can produce effects. So the muscles around the eye that are depressors, if you neutralize them, they start to raise. So you can lift your eyebrows up. You can actually change the shape of eyebrows if you choose to. Some women do enhancements like that, and even though they don't have dropped brows, they would like to change the shape. So you can do a fair amount with that, and that's why the neuromodulators, of which Botox is the most well-known, work so nicely with the dermal fillers.
Got it. Well, that's really interesting. And the thing that I like about working with you is that people don't come out looking like crazy people. You know, they don't look plastic and they don't have these like Joker, you know, like it's really about taking a few years off their life and restoring. And I think you even sometimes ask people to bring in like baby pictures or pictures from when they were younger so that you can help take them back to what was natural for them. Isn't that right?
Yes, I do. And I also teach them how to look at their face so they get an understanding of where some of these things are that are producing the changes. Sometimes people just look and say, I look tired, or people say I look angry. And I try to educate them as far as that goes. So my biggest goal is natural. And yes, I do have them bring in pictures. I don't want anyone to look done. If someone can tell what I've done to you, I failed.
Oh, I love that.
So I go for a natural look, and you know what you see on television and what you see on a lot of the tabloids are people that like to go beyond and like a lot more enhancement. So I spend a fair amount of time with each of my patients to find out what their goals are, what they'd like to accomplish with any sort of treatment, and try to set them in the right path. Certainly, no filler and no Botox can produce the same effect as a surgical facelift.
Mm-hmm.
However, there's no downtime with some of the things that we do.
Right.
So that's what's nice. Whereas a facelift, you're down for a good 6 weeks. That's not the case when you do fillers. You can come in at lunchtime and have fillers injected or Botox injected and
Go back to work.
Go back to work and no one notices.
Yeah, that was such great information. And I think we've covered a lot today. Is there anything that I just didn't know to ask you that you would want to share with the women out there?
Well, certainly I'm happy to address any of your concerns and any of your members. When I give consultations, they're all complimentary. There is no obligation involved. We talk about things, and we have a lot of people who come in. And certainly if there are specific questions that any of your members have, I'm certainly happy to address them through your site or in my office. And I'm always around.
Great. Well, I think you're one of the only men that's currently in the Essence of You group. So those of you that have questions for Dr. Faludi, you can go ahead and post them in the group at any time. And I know he and his office manager, Janice, are watching, and they are happy to weigh in. And I think you guys should provide content for us from time to time. If you see articles or if there's new things out there, I hope you'll contribute to the group and enrich our lives with your knowledge.
It's a privilege and an honor to be included in this group. And yes, we'll do that because there are new things coming up all the time. As I said, it's an emerging field and it's technology driven. And Botox and dermal fillers are the most done procedures in cosmetics in the world. And they work.
Great. Yeah, absolutely. Well, thank you so much.
You're very welcome.
All right. Bye.
Bye.